Hey everyone, welcome to All About the Joy. I'm so glad to have everyone here. Cynthia, no laughing, but I'm glad that you're here today. Mario is in the house, and maybe we'll see Alma a little bit later. Thank you. And Rick Costa, as always, so glad you're here. We have my friend Nilu here. Hi. And I'm going to try again to say your name. It's Rustomji, right? Nilu Rustomji.
Yep, that's it.
And as I said a little bit earlier to you, I can't believe I didn't know your last name up until this moment, but you actually do all my Botox. And I'm sorry, I'm repeating that again. We're not supposed to call it Botox. I always mess up. Anti-wrinkle. What is it?
Like wrinkle relaxer treatment. Yeah. It's like a broad term for all the different types of wrinkle relaxers that are on the market.
So instead of saying Botox, which is like saying Coca-Cola instead of like Pepsi, for people who don't know, because most of our audience, I don't think is really big on, I'm sure Rick's audience, huge on Botox and stuff. But you do a lot of skincare, and the reason why you and I connect so well, and it's, one of the reasons why I want to tell people how I have guests on the show, how I meet them, is I actually went to a place where you used to work. And I had a person that I would work with, and she would do my stuff. But then she went on vacation. I met you, and that was the end. It was just after that. You just have a whole different approach to skincare that I love. I love your website. Oh, let me promote your website now, and I'll put it at the bottom for everyone to look at, but it's yourskincoachnilu.com, and that's NILU.com. Yep. But why don't you tell us a little bit how you got into doing skincare?
Yeah, so of course, I didn't think I would be in this role at all growing up. My parents are like immigrant Indian people, and they have no idea what Botox or any of this is. But I studied psychology in undergrad and went on to PA school where I was doing different rotations. I landed a rotation in dermatology and kind of, fell in love with it. I really liked the procedural hands-on aspect and being able to relate with patients, spend more one-on-one time with them in like a more intimate setting. So I actually ended up doing medical, surgical, and cosmetic dermatology for a few years in Santa Barbara before coming back to LA and focusing just on cosmetic, injectables, and skincare.
What's so there's a huge psychological aspect to how you do skincare as opposed to the idea that, because I've always, and we can talk about this later, I think other people have questions, but whenever I tell people I've had Botox done, like whenever they say, oh my God, your skin looks so good, I'm like, yeah, it's Botox or whatever. Because when you notice Botox or when you notice it, that's when it's badly done. But most people who get it done, no one would ever know I'd had it done. No one.
Right. Exactly. You always think about the people that you see out on the street or in Hollywood and like, oh my gosh, they look terrifying. They do Botox or they do too much. But yeah, exactly. You don't think about all the people that are walking around that you wouldn't otherwise think twice about that do have work done. But it kind of goes to show that it can be done very naturally, very elegantly. My whole approach is, I don't like cookie cutter approaches. I think that we're all unique and beautiful in our own ways, and we all come from different backgrounds. And so I just really try to highlight that and like each patient's unique anatomy and what are their goals? Like, what are their concerns? Like someone that's an actor doesn't need to have no movement at all versus somebody that might want to have, that has like really deep lines or wrinkles, so you have to always cater to the patient, ask about their lifestyle, ask what they're doing at home.
Mario, would you ever get it done?
My wife wouldn't let me. And also I have questions because for me, like for most listeners and viewers, they know that I have kidney transplants. So I'm immunocompromised. So there's certain things that I cannot do. Like I always wanted to get a tattoo, but I can't do it. So my wife has, always wondered what that looks like for someone like me. Could I ever do something like that? Even though, because I've had a major weight loss. I've lost like 130 pounds so far. So now I have a lot of wrinkles and because a lot of loose skin in my face. So that's something I always have a question about if I can do that or not.
Of course. No, that's very valid. And that actually is a good thing thing to bring up because a lot of people might think that, oh, it's Botox, whatever, it's nothing, but it is still a medical procedure. And to your point, it's really important for us to screen patients for these things. But I always defer to your rheumatologist, your PCP, your regular physician to get clearance. But in your case, I'm not providing medical advice, but if they clear you, which they probably would because it's a very it's pretty non-invasive. And we do treat a lot of immunocompromised patients. In fact, patients that are undergoing chemotherapy or have cancer, like sometimes they come in just to feel good, and they are oncologists, tell like go get whatever you need done to feel better, to feel happier. So yeah, we do treat patients with that have immunosuppression or immunocompromised, but we always will just recommend getting clearance from a physician.
See, that's a question a lot of people wouldn't know.
Yeah, no, that's a fabulous question. Yeah. And a lot of these.
I did my homework today.
You did.
You earned your salary, Mario.
A+.
Thank you.
I've also heard of people using it to get rid of migraines.
Exactly. Yep. Yeah. Yeah. So thank you. Yeah. So I was going to say a lot of these medicines that are, now aesthetic treatments were first indicated for medical use. So migraines, nerve disorders like movement disorders, urinary incontinence, excessive sweating. So,
really?
I didn't know that.
Yeah.
Yeah.
I did not know that. Oh, wow.
Yeah.
I was today years old. How about that?
That's right.
Now you did extra homework.
More homework.
I'm keeping tabs. Let me just write this down. Rick, do you have any questions? You're falling behind on the homework part of it.
I was just wondering, like, the difference between all the technology we have now compared to like 25 years ago. Is it like really, really different or pretty much the same?
That's a good question. I mean, a little bit of both. Botox, I think, first got its aesthetic indication, at least in like 1989. But these, again, medications have been studied for like decades now at this point. I would say newer formulations of, let's say, like Botox or certain fillers are still being developed. I would say more importantly, we're learning as practitioners or healthcare providers how to do it more properly. We're learning a lot more about facial anatomy, about, which plane to inject in without going into too much detail. So it's really actually about, I think, like finessing our expertise, which makes it so we're constantly learning, which is so cool. And so, yes, there's always new products like coming out or in the pipeline, but a lot of these have been very well studied for a long time and are pretty safe for use.
I think one of the things I found interesting that you do that I didn't have done before. So I used to go to a man who's a surgeon, but he does plastic surgery, whatever. And I went, why is Mario laughing?
Because we're talking about derm and I keep looking at my wrinkles in my forehead.
Baby, you're beautiful. No. So I just go to a very prominent place because the way I ended up learning about Botox was I had this friend who I met getting my nails done. This woman, she was next to me getting her nails done. I was having a conversation. She interjected and we started talking afterwards, and then we went out to dinner. We became friends. And a year into our friendship, we were having dinner and I was like, oh, I really, really have to get something done. Like you kid around with your friend. You're like, oh, I got to get something done here. And she was like, oh no, what you need is like some Botox here and here. And I was like, I was like laughing because I was like, yeah, girl, whatever, because I knew nothing about it. And she's like, no, for real, if you ever want to go with me, I've had everything done. And I'm like, what? She had her nose done when she was 18. She'd had her boobs done. She'd had a facelift. And I'm telling you, here's how naive I was. I honestly can tell you before that day, if someone had told me that they had all this stuff done, I'd be like, I can't be friends with her. Because I had a judgment about it.
Yeah.
And here I was hanging out with this woman for over a year, having dinner once a month. Like we'd always get together. You know what I mean? We went to a yoga class. I wanted to shoot myself because I hate yoga, but she tried to get me into yoga class and whatever. But she was a good friend. And when I realized all the work she had done and how beautiful, I would have never guessed. It never dawned on me. So I went with her. I went to I know you would know, I think we've already talked about this, but I know you would know who it is, a surgeon or whatever. And when I went in there, I left there. I went in thinking, okay, well, yeah, maybe I left that visit being like so broken. Like I was ugly. I needed everything done. Like you need filler here. You need this there. You need all this stuff. And
he obviously didn't take any psychology classes.
All right, exactly. I don't want to generalize, but a lot of male surgeons,
yeah, I mean, and look, here's the thing, he's very prominent. He's worked on a lot of Hollywood celebrities, and I know, Nilu, you know who it is, but it's just, I think he just like he was just cutting to the chase. Like, here's all the stuff you could get done. It'll cost like $28,000 and whatever. You know what I mean? Like, well, he didn't say that. He sent me to the next room, which was
right, for somebody else to say that.
Right, the whole budgeting person who can set you up with a credit card and the payment plan. And I remember being like, yeah, no. I mean, I have never had bad self-esteem, but the difference with you and where I met you is it all women there? It was all women at one point. It's all women. And that was the first thing I noticed. And it's just a whole different nurturing thing. And then you were just, I think you said to me, wow, you have such great skin. And I was like, yeah. You gotta do whatever, girl. Go here, do your thing. But I think it's that nurturing aspect. There is a difference between, and this is not to be judgmental of men in this field, but there is a difference between women helping other women through this, because I think, I'm not saying all women, but you're more about how you go about it. Like you use different things on different parts of my face.
Yes.
For the injectables, where that never happened before. It was just all Botox.
What? Yeah.
So you
yep.
And you explained it to me. You were like, for this area, we're going to use this, and for here. So I get Botox just so people because I don't think anyone in this room Rick, you get a lot of it done. I can tell. We're almost sitting there frozen. So.
We listen and we don't judge.
So everyone knows, I don't mind sharing. So I have a line that goes here, right? It's a pretty deep one that goes through here that bothers me. And you can't see it now because.
So she thinks.
Yeah.
No. Nilu does it. Nilu does it for me. She erases it. But there is a line here that I have that you can't see now.
So you're saying you look like a Vulcan without Nilu.
That's right. I look horrible without her. But it's called the 11s, right?
Yes, yeah.
But why do I only have one line? It's weird.
It's not weird.
This is what it is. I have one line.
It's your little muscle, So sometimes actually, and that's, again, we're all very unique. Somebody's muscle here can be distributing in various different ways. So the line there might look different than your neighbor's line, you know?
So we put a lot here, and then I get this area here done, whatever that's called. What's the outside eyes? What's
the crow's feet.
The crow's feet. I don't like that term. I think we need to change that to something. Right? It sounds nasty. Crow's feet. We need to call it something else, like, I don't know, whatever. Like kitten whispers or something, or something like that. Right?
Would you prefer talons?
What?
Would you prefer talons?
I don't even know what talons are. I'm so sorry.
Bigger claws.
Yeah.
I'm just saying we can be more positive about it. But anyway, and I get those done, and I get the forehead done. But you do it lightly, so I can still move my eyebrows. So I don't have that thing where you can't move your eyebrows. And stuff.
Or you're too heavy. We don't want that.
What's too heavy? Oh, when it's like.
You feel like that, your brows are way down, your lids are, lower. You want you nice and lifted and awake.
Yes. See? So, but what else do you enjoy about doing the work that you do?
What don't I love? No, I think you actually kind of mentioned it a little bit earlier. Mostly women, mostly female patients. We do definitely have a good number of male patients coming in, but I just love and I'm so inspired by my female patients that are hustlers. They're moms. They have 10 different roles, and they, you know, for me, it's my opportunity as a healthcare provider to take care of them and for them to like get in that chair, just let go of everything, relax, and like take care of themselves. And I feel like, you know, as women, we're oftentimes in a nurturing role or whatever. But now, like at least in our generations, we're full-time employees a lot of the times as well. And so being able to navigate all those things, being a mom, being, you know, working full-time, whatever it is, we might not often give ourselves grace or time to like take care of ourselves. And so being able to provide that for patients is really rewarding. Yeah. And I learned a lot. I learned so much from my patients. I learned a lot from you, Carmen.
We had a great conversation last time. That was just too funny. I mean, I couldn't believe, I was so excited I was nervous about asking you to come on the show. And then when you were like, yeah, that's great. I was like, oh my God, really? It was so random. Well, Cynthia, do you guys have any other questions? I don't want to dominate, but you know, jump in. Because you know me, I will have the conversation by myself with her, and you guys just be out there in the outline. No.
Uh-oh.
What just happened? I gotta find him. What just happened, Mario? What happened? I gotta move you over.
I was just sitting here minding my black business, and it happened.
That's a good segue. Is there a difference when it comes to different ethnicities, colors of skin tone when you do some of these procedures? Because I want to be clear. I have no idea what's happening. I don't know what he's doing. I don't know either.
Usually it's me.
I'm just sitting here. I swear. I'm not touching nothing. Look, I turned the TV off, make sure the internet's off. Look. Nobody else is here. I don't know. Sorry.
Again, it's our first week. But let's go back to that question. Like, is there a difference between different ethnicities when it comes to all the different types of skincare you do? Because I want to be really clear. You don't just do wrinkle relaxing. Oh my God, why can't I think of what it is? What is it?
Wrinkle relaxer treatments. Yeah.
I can't say that. You
I
know
love
what
that term.
I'm tripping over my own tongue here saying it. But Botox, it's not the only thing you do. You do a lot of other things that's on your website as well. And again, I want to do a shout out to your website one more time. Your Skin Coach, Nilu, NILU.com. But yeah, I'd love to know that. Like, what is the differences, or are there any differences?
Yeah, no.
Ethnicities?
Yeah, great question. I would say a really common one that we have to, you know, consider is things like lasers, microneedling, chemical peels. Usually a procedure, especially that involves heat, like lasers, I can't do a lot of lasers because I might pigment. So I might hyperpigment or hypopigment. So like I can get darker, lighter spots after certain treatments because we have more melanin in our skin. So certain procedures, not that we can't do all lasers, you know, there are lasers that are safe for like all skin types across the board, but there are some that you want to just be more cognizant of. And certain peels, like if they're like really high depth peels that are getting deep into the skin layers, we'd have to be a little more careful of as well. In terms of injectables, you know, like Botox or filler, you know, we do that for.
Well, maybe you should explain what filler is, because I don't even think you guys know what filler is. Do you?
Yes, I'm very astute. Thank you very much.
Maybe for Cynthia and Rick, or for our podcast listeners, maybe they don't know what filler is.
I'm so joking.
I know. I love you. Okay.
So filler, it's commonly called like dermal filler, and most dermal fillers are composed of what we call hyaluronic acid. Hyaluronic acid is a component that's naturally in our skin already. It's what draws water and moisture into the skin and hydrates it. So basically what, you know, these chemists have done essentially have created synthetic hyaluronic acid gel. And that's what is in a filler. And what it does is, you know, when we inject it, let's say really commonly in the lips, you know, the gel kind of plumps up the lips, it hydrates the lips.
Yeah, but sometimes that looks so bad. If it's done badly.
Shout out to Kylie Jenner.
You're so mean. You don't know that could be your client. You're just giving a shout out to Kylie Jenner.
Just a pleasant shout out.
So
I know.
I actually have a question about the hyaluronic. So of course we've seen commercials about hyaluronic acid creams and serums and things like that. Do those work just as well as the injections?
Not for the same purpose. That's a great question. So topically, so in like skincare, like lotions and moisturizers, hyaluronic acid in it is beautiful. It can really help, again, seal like moisture into the skin.
Mm-hmm.
So if you have dry skin, if you have eczema, it's great for that. But it's not filling areas of volume loss. So for instance, Mario, you were saying like you lost some weight recently. So a lot of patients, you know, that even on like Ozempic or any of those like weight loss medications, they've also noticed a lot of like volume loss in their face because that, you know, goes down over time. We lose bone mass, you know, all those, our skin starts to sag or whatever. So filler can actually help when it's injected to refill areas that we've lost volume. So topically, it's not going to, you know, go in deep enough to replace that volume because it's deeper areas in the face that are losing volume.
Some people get it like they get it here at the laugh lines, right? I had filler done once by that man, and they messed it up. I'm sorry.
Is it the one who will not be named?
The one who shall not be named. He does huge celebrities, by the way, but they put in filler here. Why do they do that? Why do they
they're not really doing that as much anymore. Like in the under eyes.
Yeah, they did in the under eyes, and then it was stuck here. Yeah. And by the way, that doesn't really go away for like a year. I went back in and he was trying to, whatever they were doing, trying to take it out, but it really stays for a while.
Yeah, they can be stubborn. It can take some sessions of dissolving. We don't, you know, we do under eye filler still, yes, here and there. But again, so actually goes back to one of those things that like as injectors or surgeons, we've learned now, you know, filler is not usually the best treatment for that area. It's such a thin area. Like the skin is so thin there. It's very delicate. It's our eye muscle surrounds that area. It's constantly like blinking and contracting. So why would you put a gel there that, you know, takes in water and moisture and plumps the area? You don't want to get plump here. You're going to look like you have big under eye bags.
And I did. I had a thing right here. And here's the thing. You have never said to me, this is the other thing I like about you. I've never walked into your office and you've been like, "Ooh, you know what, Carmen, I think it's time for you to try blah, 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 blah." You know, like if anything, you kind of dissuade me from doing things because I'll be like, okay, no, but seriously, what about? And you'll be like, yeah, you're good. It's all good, you know? But I think that's a really good thing because you're being very honest and you're not going to overdo it. You know, like as we were talking about some celebrities it was like 2 sessions ago, whatever, in our private lounge, or I think it was a Friday night thing. This obsession with like Pamela Anderson not wearing makeup. And, you know, everyone is so like, oh my God, she's so beautiful and she's so awesome and rah, rah. And yeah, I'm all happy for her, but she's had a lot of work done. So it's very different than a woman of her age. And I believe she's in her 50s now, right?
I think
she might be a little
She's
older.
a woman of a particular age.
She's a woman of a particular age. Thank you, Mario. But I think she's in her 50s. And so the idea of us being all excited about someone who's going quote unquote natural because they're not wearing makeup really irks me, which is why I always talk about what I do. But go ahead. I'm sorry.
Sorry to cut you off. No. But that's like a pet peeve of mine when they're like, oh, I've never done injectables or I've never done Botox, because they'll name, I think this is my theory, certain celebrities will name the brand because then they could be like, well, I don't get Botox, but secretly they actually get Dysport or different brand, you know?
Right.
These kids or whoever, you know, other young adults that are like looking up to these celebrities thinking like, oh my gosh, they have perfect skin or they have a perfect lips or perfect face and like they're all natural. Like, you know, it's just like I teach their own. But for me, I'm like, oh, you're just making other people feel bad by not being honest.
Yeah. I mean, and you use Dysport here, right? I forget what it is, but you have,
I believe so. Yeah.
so like if I were to say something, like let's say I was being interviewed, I'd be like, oh yeah, no, I don't use, what's a third one I've never used? Because I use Botox and Dysport. There must be another one. So that's what you're saying. People are lying and saying.
That's I wonder that sometimes. Yeah. Like, who is it? Like, oh my gosh.
That's how they're getting away with it. They're saying they don't drink Coca-Cola, but they're over there drinking Pepsi.
Yeah, exactly. That's my theory. There is no way like this celebrity has not done any, like she using olive oil. Okay. Olive oil.
The lies.
Well, that's when it's crazy too. And here's the thing, now that I do it, and I've been doing it for years now, and I get it, I can tell. I can just tell. I can pinpoint. It's like gay radar or something. You know? I don't know. Like, you can just tell, that somebody has. I really have bad gay radar, by the way. But my friend Richard used to be able to be like, I'd be like, oh, that man is fine. I'm gonna give him my number, and he'd be like, yeah, he's gay. Don't even bother. Like, don't want my number, but go ahead. All the time. But can't you tell? I mean, you're a professional, so you can tell when people have had stuff done.
Yeah, usually. I mean, on TV, sometimes sometimes I can't focus on like whatever these reality television shows and stuff because I'm so focused on their face. I'm like, oh my God, they look terrible, or like so.
Okay, wait. Do you sometimes look at people and be like, wow, they really do need some work?
No, usually it's the opposite. It's like you've done too much.
Oh, okay.
Yeah.
Okay.
Or like part of it's still moving. I'm like, no, that looks weird.
I do have a question. Do you work with people who have like surgery scars, like keloids or things like that, and helping them reduce those scars?
Very good question. Yeah, so I did that a lot in my old dermatology clinic, where I was doing more like medical surgical dermatology. We would sometimes remove even big keloids like on the ears surgically. A lot of times we can inject it with Kenalog, which is like a steroid.
Can you just tell me what that is? What is? I don't even know what you're talking about, Maria. I assume.
For example, I have keloids are raised scars on your body. So, for example, this is a keloid.
Okay.
Do you see that?
Yeah. Okay.
That's a keloid. So it's a raised scar off the body that you can actually see. And then there are ways to reduce the size of the scar. So I was wondering if she worked with people with stuff like that.
Okay.
Yeah, and a lot of dermatology or aesthetic practitioners will. And so you can typically inject it with the steroids. So it's different than, Botox or filler. But we've actually found there's evidence that like even for women like who's recently had a C-section, or if you have a recent injury or surgery, doing Botox around the line of injury can actually help prevent like scarring, or maybe even keloid scarring. Keloid scarring is like kind of a next level type of scar, but we have found that because I have to read more into like the research behind it, but it I think helps basically relax the muscle fibers around that scar so it doesn't contract as unevenly and like it's not as misaligned. So it is actually kind of a cool, like Botox can be used for so many things. It's quite fascinating.
Okay, cool. I've done my homework. Yay.
Rick, you seem so comfortable. Are you okay? Wait, I want to make sure Rick's okay.
Did I scare you with my scar?
Rick is usually very talkative. I'm so confused.
Oh yeah, so talkative. I'm absorbing all this. This is all new. I'm absorbing it all.
Okay.
I did have a funny question. Maybe funny, maybe not funny, but do you ever get anybody come to you and be like, I want to look like this? And you're like, baby, I'm not God. I can't do it.
Yes. Oh my gosh. Yeah. It doesn't happen a lot, but it does happen. And it is a little bit of a pet peeve of mine as well. Cause I'm like, yeah, first of all, that's a filter. So that's not even a real person.
Right.
Oh, right.
Sometimes it's like, they're using a filter or pictures of somebody that has, completely different anatomy or features. And again, it doesn't happen a lot. Usually for me, it's more so just like setting realistic expectations of what we can achieve with injectables alone. I mean, granted, I'm not a plastic surgeon, so maybe they can do it, alter the appearance a bit more. But also, we have to, the psychology that comes in is, we kind of mentally have to screen for patients that might have body dysmorphic disorder or something else going on where, they may not ever be happy with whatever cosmetic treatment they get. And that's a different type of thing.
Does that come up a lot?
Oh, God.
Not a lot.
No.
At least not where I work. I'm in Santa Monica, where most of our patients are very like, I want it natural. I just want to age gracefully. Yeah, Carmen.
But you guys do screen, like, so the way it happens is you have to fill out all this paperwork. I mean, it's on an iPad thing or whatever, but you have to fill out all this stuff, and you have to, they take pictures every time you come in. Why do you guys take pictures every time?
I know sometimes it's, patients may think it's a little excessive, but it's kind of like it's like a tool for us, so we can see the progress, which is really nice. But also if they're a lot of times patients like don't notice certain things until everything else looks better. And then they're like, but now I have this. And then we look at the photos and we're like, oh, but you always had that. And you're just noticing it more.
Right. Okay.
It's actually kind of nice for patients too. They're like, oh, okay. I see it now. So
yeah, but I'm just saying it's a pretty intensive thing. And I feel like you guys take a lot of time. Well, you take a lot of time to talk to people to get a feel for if they're crazy or not. I don't know. It's just my feeling. I'm just saying with me, because it just felt like you took so much time. I'm like, this girl ain't got no other appointments to get.
Meanwhile, my staff is like ringing the line. They're like,
you need to go, girl. No, I'm just saying it's very thorough. And I think that might also be the difference between, again, this is just my experience. And I've been having Botox done, I think, for maybe a good 10 years now. Maybe 10 years. And I have to say, in my experience, there's a difference between going to men and going to women if you're a woman. For me, it was, you know what I mean? Or it has been. Mm-hmm. But there were also what they call Botox bars. Is that the right terminology? Do you know what I'm talking about?
There's so many, like, so where you go to like somebody's house or they come in like a truck?
No, like on Montana here in Santa Monica, where it's like you walk in and they're just like off the street. Yeah, you should never go to those places. You should always go to a licensed person. I mean, why don't you tell us what you should do, Nilu? I don't know. I mean, you can get Botox at your nail salon. You can get it. I would never do that. You can get it. Seriously, you never noticed that? You go into a nail salon, they're like, can we do Botox and waxing? I'm like, I would never do either one of those things. You know what I mean?
Number 2, please, cocktail and fill in my hair.
Right?
I'm doing it at the fast food restaurants now too.
Tell people who might be interested in their first time what they might want to look for or stay away from.
Yeah. I mean, do your research, right? So, who's the provider that you're going to? Where do they go to school? Where do they get licensed? What kind of training do they do? What do they do on a daily basis? Not to say you can't do lasers and other things, but for us, like, I specialize just in injectables, which I really like. So I'm not a jack of all trades. I'm really specializing in this one thing. So I think patients really like that and feel more comfortable with it. Reviews, referrals, those are all.
Referrals are the best. Yeah.
Yeah. I think referrals are great because then, okay, like my best friend or my cousin or whoever has seen them, they trust them. But really, you want to go to a licensed medical professional, which at least in California, I'm not sure about the East Coast states, but usually it has to be an RN. So a registered nurse practitioner, PA, physician assistant, which is what I am, or an MD, medical professional, like a doctor.
Right. And look, that's not to say that places that people go, and it is here on Montana, on Santa Monica, where I went once and I was like, okay, I'm never doing that again. Like, cause I was so afraid. I felt so uncomfortable. They were nice and it was fine.
Right. So yeah, it's not to say that they aren't, professional and don't do a great job. They might, so I don't know if there's a certain place you're mentioning, but like, cause that's the other thing. These med spas are opening up very quickly.
Yes.
And across the world, and I've been hearing like in London, people don't have to be licensed at all, like medicine, I believe. So then that's where it gets really scary. Cause then where are they getting these medications from? Where are they getting their dermal filler? Where are they getting their Botox? That's where it gets really scary because there are fake Botox companies out there that distribute them. And
that's her dog. She told us. Yes, no. So we can let her dog bark in the background.
My friend just got home, so
I have a question. What are like the most common side effects to like not the fillers, but the injections, Botox, all things like that? And are there any long-term effects that can happen?
Beauty. Intense years.
I know I always joke the biggest side effect is you get addicted, but so with any medical procedure, there's always certain risks, benefits, side effects. So most common risk, or not really side effect, most common risk is risk of bruising or swelling at the injection site. Usually it's pretty minimal, goes away in a few days. With Botox, you can put makeup on like within 10 or 15 minutes. Sometimes patients might get a dull headache the next day or two. Doesn't usually happen with each treatment, but sometimes your first treatment or two, you can get a dull headache, usually just because there's so many pokes. What else? There, scary stuff that you might see online is where you get what we call ptosis or droopy eyelid. That's very rare. It sucks. It can happen to anybody, any practitioner at any time, unfortunately. But again, it's very rare, and we usually do things to try to avoid that. With Botox and these type Dysport and all these different wrinkle relaxer treatments, most of what we do is not permanent, which is nice. So knock on wood, if you ever get a horrible side effect of like a droopy eyelid, it will resolve within a few weeks.
It's like 2 to 3 months, right? I kind of see you every 3 months or so. I seem to, but that's not always the case, because this is the other thing you have to understand. When you go to certain people, and I don't know why this happens, you go to certain people and you pay even the same amount of money, but then it doesn't last as long. What's that about? And then sometimes you pay the same amount of money and then your office is calling me like, Carmen, are you coming in next week? I'm like, I'm still fine. What's that about? Why is that so different?
There can be so many variables. A common one that people assume is like, oh, they're over diluting their product or whatever, which at this point, I don't think is very common. Hopefully not. So Botox, Dysport, these all come as like a dry powder form. So we all have to dilute it. We have to mix it up into a liquid solution to inject it. But maybe some cheaper places will over dilute it so they get more product to be able to inject in patients. And that's where their results might not be as strong. Again, I hope that places aren't really doing that anymore. It's not good practice, but like a patient's metabolism, if you're young, you work out a lot. Yeah, you go to yoga, hot saunas, you're sweating a lot. Sometimes you might just like metabolize it very quickly. A lot of times it's the dose. You just need a higher dose. A lot of young clients or patients come in for like baby Botox. So it's like taking a half a Tylenol versus a full Tylenol. If you take a half a Tylenol, you might not get the maximum effects, or it might, the effects might not last as long because you're not doing a full dosage of what they recommend.
Wait. How young are people that you just said baby? I just freaked out. Like,
baby, you're getting Botox.
wait. But how young do you see? There an age you will not see? I
don't usually feel comfortable with treating patients that are like under 21.
Okay. Yeah.
I think, because FDA, I think for all of these treatments are FDA approved for 21 and up. Okay. I've had very rare cases where like the parent wanted the patient to be treated, which is also kind of weird to me, but or uncomfortable. But so I will have like parent sign consent,
Oh, and you'll have to do it? Yeah. Oh.
Yeah, they do. Yeah.
Have you ever not done it because you disagree with doing it for someone?
Yeah. If I think it's going to be unsafe for them, if I think that, or if they have a history of being unhappy with treatments, certain red flags like that. Because then at the end of the day, no one's winning, right? Patient's unhappy, I'm unhappy, if the results aren't going to look good, if it's unsafe, like those are, it's not worth it at that point.
Right.
But to answer your question, I would say like what we call baby Botox for most patients, they're coming in for that maybe like in their early to mid 20s.
Yeah, I don't think I ever even thought about Botox until I hit my 40s. It didn't even, well, it never even dawned on me. I had such an attitude about it, first of all, because I was always thinking about bad Botox. That's what people don't understand. When you're looking at Botox or you're looking at someone and you don't like the way they look, although you should keep that shit to yourself. But if you don't like what you're noticing is someone who's maybe gotten it overdone or has done too much, or is there an ethical, like, I mean, of course there is, but why do surgeons and doctors go overboard? I mean, do you ever do a mistake and be like, oh, maybe that was too much to give her, or I'm not going to give her that much again or something? I'm asking you to tell me when you fucked up online.
He's trying to mess up her reviews now. Come on.
No,
She's trying to keep her 5 stars on Yelp. Okay, stop.
No, but you know what I mean. Like,
I think for me, I'm like, if there's ever anything, like, tell me, come see me. I will fix it for you. Because like, no one's perfect, especially if like, you know, it's a new patient to me. Everyone's anatomy is so different. So that's my, I'm like, just come see me, harass me. I need to know so I can help you. Because yeah, I'm not perfect. I don't ace it necessarily every time. But I think less is more. And I think Carmen, obviously agree with that. And that's why we get along so well.
I know.
So, yeah, I don't know. These surgeons, I mean, and there's so many great surgeons out there, obviously. So, but I think these ones and like that we see with the Hollywood celebrities and stuff, I don't know. I don't know if it's like, if it's money, if it's maybe they just feel uncomfortable saying no to these high paying clients. I don't know. Or
it's just weird because sometimes you see the lip thing and I'm like, no, seriously, you think that's working? Like that, who did that to you? Like the lip thing bothers
you.
When you're walking around and you're like, it's too much.
It looks painful.
There's like a Christian woman that's pretty famous in the Christian realm, and she definitely had lips done, and I can't even look at her now. So I'm like,
it's distracting.
Yeah,
I can't look at her.
Yeah.
Tell me what she looks like, Rick.
Is anybody like, and how do you find out? Is anybody like allergic?
Good question. So that's something that we screen for as well. Typically not with the actual product, but we do screen for allergies to the enzyme that can dissolve filler. There's sometimes cross reactions with like bee sting allergies, but Botox.
Did you say feasting allergies?
Bee sting. Yeah, like bees.
Oh, bee sting. Got it.
Feasting, like eating, right? Eating.
I'm like, what?
That's the allergy I seem to have. The eating.
Do you do like a prick on like a unnoticed part of the body or something to test?
I have done that. I don't. It's very rare I have to do that, but yes, we can do that. Or I'll send them to an allergist because if they have like, if I'm really actually worried they may have an allergy, I'm like, I'm not well equipped. We have EpiPens and Benadryl, but if you're going to have a really bad episode, I want you to go to an allergist so they're better equipped to handle that.
But also, like, I have an EpiPen and I have the medical bracelet, because I'm allergic to penicillin and shellfish. And when you walk in the office, they do an entire health thing and they ask for your doctor's name. They ask, it's such it's annoying. You know what I mean? Because I'm like, I'm just getting Botox. But that's why they do it. Yeah, that's why you do it, is so that you have all that information. And then when you meet with the person the first time, they go through it and have that conversation. Yeah. And I guess you guys just put that in the file. Because I met you after that. I met you after I'd already started going to your office. So
yes. Yeah. If there's like something very pertinent in a patient's medical history that I need to see or be reminded every time, I will like write it all up in their chart. Like, I don't want to forget this.
Now, I have another question, Nilu. For those people who are afraid of getting Botox because they don't like needles per se, okay, is there another technique or product they can use to help with skin tightening?
Yes. And actually those patients are some of my favorites. They're so cute. And then, because they work it up, usually they work it up in their head, and then I start and they're like, oh, that was it.
Right.
So yeah. And I have really close friends that are still terrified of blood draws, will pass out every time, but they are fine now with Botox. So, but yeah, so let's say, patient's not qualified for Botox for whatever reason, which is very rare, or they don't want to do it and they just want more natural ways to take care of their skin. I'm a huge advocate for like topical retinol. Retinol is great for the skin.
Okay.
It's, helps to produce collagen. It helps smooth fine lines and wrinkles, scarring, pigmentation. Long-term use, it can actually help prevent skin cancers, which is really great. A lot of people don't know about that. So that's like the cheapest, easiest thing that you could do at home.
Okay.
You can either get it prescribed, or if you go to, let's say, like a med spa or something, they'll usually sell like a medical grade version. There's also over-the-counter versions of it,
Okay.
but the over-the-counter is weaker, right? I mean, it's a weaker version, the over-the-counter.
Well, depends, right? So it might be weaker than a prescription one, but also I'm not a huge fan always of the over-the-counter ones because the technology is not that great and it might be more irritating. So a lot of patients are like, oh, I tried, over-the-counter retinol and I was so dry and red and flaky, and I know. And I'm like, oh, we just got to get you on the right one. Like there's better ones out there that are formulated to be more gentle, soothing, released in the right layer of the skin, so it's tolerated better. Yeah.
But the needles you do, I mean, Cynthia, I know you hate needles, and I am not a fan of needles, like especially because I get blood work done because of my thyroid situation, and like regularly, which is annoying me. But when you do the needle, it's like, I mean, we're chit chatting, blah blah blah, and you're like boom boom, and I'm like, am I done? You're done, like. The needles are really thin that you use too. They're like,
they're like little insulin syringes. They're very tiny. Usually I'll be tapping you to like help distract you. You have a little squeezy ball.
And I'll be like squeezing the ball or whatever. And then I'm like, I don't squeeze the ball no more.
We're usually chit-chatting. We're having fun in there. So
So weird. I know you're very good at it. I mean, I know you know that, like I've said that to you, but it's the most comfortable I've ever been. I enjoy going to see you because I always feel good when I leave too. So it's not just the work that you're doing but and this is just my experience, but you can tell me what the correct thing is. But when you get Botox done, it takes a few days for it to actually kick in. Correct. So it's not like you get it done and all of a sudden you're like, wrinkle free. It takes some time. But when I go and see you, I feel like so relieved because I feel like I've gone to take, like I had some self-care.
Yes, 1,000%. And I almost see it as like acupuncture because it's little needles. So
yeah.
Oh, wow.
Cynthia, you were asking about like migraines before. So we don't, it's technically medical treatment with migraines, but sometimes I'll do little areas for patients if they need it for tension release. So like do it for grinding. If people grind a lot at night, in the temples with grinding and like migraines. And yeah, sometimes they say they feel like immediate relief. So I do think that there's something to be said about that, about just like the needle relief.
Yeah. And I've tried it in different places too, like, cause we were trying to see if we could, cause I'm starting to get like little jowls here. Anyways. And so instead of, I never want to have surgery again, knock on wood. Like after having my hip surgery, I never want to have surgery again. But we tried it there and I was like, okay, it didn't really do anything. So, and there was no pressure like, oh, you have to try it again or you have to do it this way or whatever. It was like, okay, it didn't work. It's fine. Yeah. You know what I mean? It didn't work for me. But the needle didn't hurt here either. I think that's just the technique you use or something. I don't know.
What about I'm sorry, Cynthia. Go ahead.
My question is, so once you start it and you're going for a few months here and there, do you have to continue or can you just stop at any time and not do it ever again? Or is it something that you always have to keep doing?
No, you have to do it all the time. She makes you go.
Carmen's going in. Every yes, yeah, absolutely. You can stop. And so patients often ask like, well, if I stop, are my wrinkles going to be worse? No, so you can stop at any time. You just go back to, your baseline. But like, if you're doing Botox for 5-10 years and then you you stop, you also age during that time. You might have like a little more sun damage or, things like that. But, if you're consistently doing it, you are preventing lines from forming and getting deeper as well. So that's why a lot of people see it as like preventative Botox, because you're preventing deep creases and lines from forming over time. So even if you decide to do, stop one day, your skin's probably still going to look better than it would have had you not done it.
Right.
And actually, I think too, like if you're investing all this money to get injectable treatments, you're probably investing in skincare too at home, or using sunscreen or using retinol. You're probably doing other things without even really knowing it. That's also helping.
But it's like getting your hair done in a way. Like you don't have to get your hair done, but you choose to do it when you want to. And like I'm not on some regular schedule. I just know when I can see the line here, that's when I go. That's when I go in. You know what I mean? Like when I start to see that, whenever like I'm smiling or something and the line comes here, I'm like, and
oh my
making
God.
a phone call. Yeah, time to make a phone call.
What you look like, actually, like you're like, oh yeah, I forgot that's what it.
Yeah, and I do have a very deep line here, because I'm in my 50s. Like it's natural to have that, But what I love is that I did it for myself, not for anybody else. And I think that's the other part of it too, is that you're not doing it, for a boyfriend or whatever, and I want to look young. It's like, no, I don't like that crease because it makes it breaks up my face. To me, it does. I don't like it. I don't mind. Like I know exactly who it was, surgeon we talked about earlier. It was like, we could really do some work on those laugh lines. And I was like, okay, first of all, that's natural to me. I don't want, no offense. I love Angela Bassett, Cynthia. The show's on tonight, right?
Yes.
I love Angela Bassett with all my heart, but I hate the filler when people put filler here. I can't stand it. And I know she's had it. You can see it.
Are you coming for the queen of Wakanda? Are you coming for the queen of Wakanda?
I feel comfortable with the queen from Wakanda because she would admit it too. Okay.
Don't do Tina Turner, okay?
You know what I'm saying? Like, I mean, because it's the obvious person is what I'm talking about. It's like, I just don't like but someone had told me that I should get that because I have laugh lines. And I'm like, I'm not doing laugh line filler.
Like, you're a happy person. You have smile lines.
Can you imagine if you couldn't see any? I couldn't even imagine it.
Well, and then, if you overdo that, people start to look like apes, actually.
No, it's weird. It's
weird. Like, we're supposed to have, babies have teardrops, it's natural to have.
Yeah, I like the naturally look. I
do have one question. What about, does Botox help with tendinitis?
Tendinitis? Or tendinitis?
Yes.
Oh, interesting.
What was the question? I'm sorry. I'm sorry? Tinnitus. I'm sorry.
That's why I was wondering if you were, okay. Like, so the ringing in the ears?
Yes.
That's a great, not that I know of, but I wouldn't be shocked if it did. No, not that I know of, but again, sometimes I find out Botox helps with certain things and I'm shocked. I'm like, what? Like, I recently read, my mom was having, like, not her, it was like her Achilles, but the muscle underneath, like the sole of her foot, and they do Botox for that to like help with the pain.
Yeah, because I have plantar fasciitis, and they do it.
Yeah.
Thank you. Yep. So yeah, not that I know of, but that would be cool. Interesting. Maybe you're onto something, Mario.
What are some basic skincare tips you would tell us to do that have nothing to do with Botox or injectables or whatever? What are some ideas that we can do to have great skin as we age?
Retinol, again, it's a great one. Most patients can use it. Obviously talk to your provider. There's some exceptions, like if you have eczema or rosacea, maybe you'd have to use gentler forms, but retinol is the easiest, best thing you could do. Sunscreen, mineral-based sunscreen. So sunscreen that has zinc or titanium in it is best. The over-the-counter ones with like chemical ingredients like oxybenzone, those aren't as good. Okay. Vitamin C is great for collagen, sun protection, helps with pigmentation, anti-aging. Wash your face. A lot of people don't even do that.
Really?
Yeah,
No.
I feel like sorry.
What do you mean people don't wash it? You're being funny.
There are people that don't do it.
I wash my face in the morning and at night. I'm
Good.
sorry?
Yeah, or they'll only wash, once in the day. I don't know.
No, well, because at night you do sweat. You know what I mean? You do have a little, well, I do. I don't know what you guys are doing at night. I'm busy.
She said, I don't know what you're doing tonight, but I'm sweating.
No, but I'm just saying, like, and of course at night I take off whatever makeup I may have on, but also just like a cleanse, just.
I double cleanse. Not always, but like if I wear makeup or tinted sunscreen, I'll double cleanse for sure.
Yeah, I don't get people really don't wash their face. I was shocked to hear that people don't wash their feet. I was shocked by that, so I don't know why I'm shocked by the whole face thing. Seriously, you didn't see that on TikTok? People talk about how they just let the water run down their feet. I'm like, what?
Oh no.
When they're in the shower, they just assume because they're showering that the water will get to their feet, and I'm like, okay, and that cannot. And now I'm glad I shared it with all of you because it cannot get out of my head now. Okay.
Something I learned because of some Carmen, I think, said was because I had this misconception that you don't go there, walk out of the office, and you already have instantaneous results. It actually takes a little bit of time, right?
Mm-hmm.
For the wrinkle relaxer treatments, yes. So like Botox, Dysport, those types of treatments, it takes a few days to a couple weeks. So usually we say 10 to 14 days.
Okay.
Yeah. Dermal fillers.
So it takes 10, 14 days for it to really show a full effect?
Yeah.
Correct. Yeah.
Really?
Yeah.
I didn't know that.
Oh,
I was 2 years old.
Mm-hmm. Yeah, so that's why when I start to see the line, I know it's going to get much deeper. So that's when I make my appointment, because it'll be a couple weeks before it goes away. Like you can't see it now, and it's not because it's because I've had it done.
Mm-hmm.
Yeah, there is no even if I try to do it, you can't. And I'm not going to do it because that will keep doing it. But like I remember somebody, I think it was you or maybe it was one of your other counterparts. I was like, every time I do, like when I scrunch my eyes, they're like, then stop scrunching your eyes together. Like
Duh.
I do this, and you're like, don't move your arm that way.
it hurts when I do this, right? It's not doing it. But it takes for me, it's usually like I almost immediately see it here though, like within 3 or 4 days. Is that normal?
Okay. Yeah.
I guess because it's thinner skin or something. I don't know. But yeah, it's usually like a little bit before you see it fully take effect. Yeah. And you end up with this.
I have to say that I've definitely seen this wrinkle relaxer in a whole new light because I was always against it. I hate needles, but the way you describe it and everything, it actually it opens people's eyes and minds to the whole idea of it. And it's not just for wrinkles, like you said. If people have excessive sweating and things like that, or different issues, that it works. So.
Are you going to get it done now, Cynthia?
I don't know.
Oh, maybe that's what I get you for your birthday. Cynthia's going to be all snatched. I'm so glad you came on. Thank you so much.
Thank you for having me. This is wonderful.
No, I just feel like, first of all, I'm so glad we met. I'm so glad we've become friends. And I know I'm your client, but I just really appreciate you coming on. And I hope you'll come on again. If people
send my client.
No, I know. But if people want to reach out to you, if they have questions or they'd like to meet with you, even if they're not here in Santa Monica or in California, they can go to your website at yourskincoachnilu.com. They can ask you a question or whatever, and maybe you might be able to refer them or give them some more advice or information. Of course, if you're in Santa Monica or in California, please, please, please go and visit Nilu. She is amazing. I just saying, all right there. But yeah, thank you so much for coming on. And Rick Costa, thank you for being here. Mario, we miss Alma, but we love that she stopped.
Hi, Alma.
It's okay.
She's listening.
We love you, Alma. Okay. And Cynthia, as always. Mwah. And everyone, thank you again, Nilu. Thank you again.
Thank
and everyone,
you so
remember, at the end of the day, it really is all about
the joy.
All about the joy. Bye, guys.
Everyone. Bye. Bye. Thanks for stopping by All About the Joy. Be better and stay beautiful, folks. Have a sweet day.